Hantavirus is not a new virus, but every time it appears in the news, it creates fear, confusion, and many questions. Is it easy to catch? Can it spread from person to person? What are the symptoms? And most importantly, who is really at risk? The truth is that hantavirus is rare, but it can be serious. Understanding how it spreads and how to protect yourself can make the difference between panic and prevention. Hantavirus is a group of viruses carried mainly by rodents, especially mice and rats. These animals can carry the virus without looking sick. The danger does not usually come from simply seeing a mouse from a distance. The real risk begins when a person comes into contact with contaminated urine, droppings, saliva, or nesting materials from infected rodents. When these materials dry and are disturbed, tiny particles can mix with dust and enter the air. If someone breathes in that contaminated dust, infection can occur. This is why hantavirus cases are often linked to places where rodents live or hide, such as barns, cabins, sheds, storage rooms, farms, garages, abandoned buildings, or poorly ventilated areas that have not been cleaned for a long time. A person may be exposed while sweeping, moving boxes, opening an old cabin, cleaning a garage, or working in areas where rodent droppings are present. The risk is not limited to rural areas, but it is higher wherever humans and rodents share the same environment. One important point must be clear. Most hantavirus infections do not spread easily from one person to another. In most parts of the world, the main route of transmission is from rodents to humans. However, one type known as Andes virus, reported mainly in parts of South America, has been associated with rare human-to-human transmission, usually through close and prolonged contact. This is why health authorities pay close attention when clusters of cases appear, especially after travel or close group exposure. The symptoms can be confusing at first because they may look like a simple flu. A person may develop fever, fatigue, chills, headache, dizziness, and muscle aches. These muscle pains can be strong, especially in the thighs, back, hips, or shoulders. Some people may also experience nausea, vomiting, diarrhea, or abdominal pain. At this early stage, many people do not immediately think of hantavirus, especially if they do not remember direct contact with rodents. The incubation period can also make the situation harder to recognize. Symptoms may appear days or weeks after exposure. In many cases of hantavirus pulmonary syndrome, symptoms begin between 1 and 8 weeks after contact with infected rodents. This means someone could clean a dusty storage room today and not feel sick until much later. That delay is one reason why telling a doctor about possible rodent exposure is very important. The danger increases when the illness moves beyond the early flu-like phase. In severe cases, hantavirus can affect the lungs and cause hantavirus pulmonary syndrome. This can lead to coughing, shortness of breath, chest tightness, and difficulty breathing. Some patients may feel as if their lungs are filling with fluid. This stage can progress quickly and requires urgent medical care. Hantavirus can also cause forms of illness that affect the kidneys, depending on the type of virus and the region of the world. Who is most at risk? People who live, work, or spend time in areas with rodent activity are more exposed. Farmers, campers, hikers, forestry workers, cleaners, construction workers, and people opening closed cabins or storage spaces may face higher risk. But anyone can be exposed if they clean rodent-contaminated areas without protection. The risk is not about age alone. It is about exposure. Still, older adults, people with weaker immune systems, and those with existing heart or lung problems may be more vulnerable if the illness becomes severe. The good news is that hantavirus can often be prevented with simple but careful actions. The first rule is never sweep or vacuum rodent droppings, nests, or urine when they are dry. Sweeping can push contaminated dust into the air, and vacuuming can spread tiny particles even more. Instead, ventilate the area first. Open doors and windows and leave the space to air out. Then spray the contaminated area with disinfectant or a bleach solution and allow it to soak before wiping it up carefully. Gloves should be worn during cleaning, and hands should be washed thoroughly afterward. Dead rodents should be handled with protection, placed in sealed bags, and disposed of safely according to local guidance. After cleaning, disinfect surfaces that may have been contaminated. The goal is simple. Do not let contaminated dust become airborne, and do not let rodent waste touch your skin, eyes, nose, or mouth. Prevention also means keeping rodents out. Seal holes and cracks around doors, windows, walls, pipes, and foundations. Store food in sealed containers. Keep pet food covered. Remove clutter where rodents can nest. Keep trash closed and away from living areas. Around the house, reduce weeds, wood piles, and debris that can attract rodents. These steps may sound basic, but they are powerful because they attack the problem at its source. If someone develops fever, severe fatigue, muscle pain, stomach symptoms, or breathing problems after possible rodent exposure, they should seek medical care quickly. There is no simple home remedy that can treat hantavirus. Early medical attention can help doctors monitor breathing, oxygen levels, blood pressure, and organ function. In severe cases, hospital care may be needed. It is also important not to panic. Hantavirus is serious, but it remains rare. The average person walking in the street or living in a clean home without rodent exposure is not at high risk. The people most at risk are those who come into contact with contaminated rodent waste, especially in closed or dusty spaces. Fear spreads faster than viruses, but knowledge gives us control. So the message is clear. Hantavirus is not something to ignore, but it is also not a reason for panic. Know the symptoms. Understand the transmission. Avoid direct contact with rodents and their droppings. Clean contaminated areas safely. And if symptoms appear after possible exposure, do not wait. Contact a healthcare professional and explain exactly what happened. In the end, hantavirus reminds us of something simple but important. Invisible risks often begin in ordinary places: a garage, a cabin, a shed, a basement, or a storage room. But with the right precautions, we can reduce the danger, protect our families, and respond calmly when the warning signs appear.